so much, Aaron. We'll check back in with you coming up in a little bit. Taking action for your health this morning at 7:11. Right now, the federal government investigating the health risks of vaping. More than 200 cases of serious lung disease now reported in 22 states, including Virginia and North Carolina.
Now the CDC wants to know if the cases are linked to vaping. For more on these risks, let's bring in our medical expert, Dr. Ryan Light from TPMG at Greenbrier Family Medicine to tell us more about this. And Dr. Light, how dangerous is vaping?
Well, it's much more dangerous than we once thought. The research is finally catching up. Now we're getting these case reports out there that is showing this can be deadly in some cases. So we're seeing the severe respiratory illness that's out there that the CDC is following. So that's one big one. We had some research published this week about some vascular disease as well. The problem with vaping is we don't know what's in it. We don't know what happens when you vaporize it. So buyer beware on this stuff.
All right, let's get specific here about the diseases and the risk there, because there are some, right?
Yes, there are. The big one is that the CDC put this out. It went out to all the health departments. It went to all the providers out there. So now we're actually looking for it. It's a severe respiratory illness. What you get is a cough, shortness of breath, and some fatigue. Sometimes you can get a headache, fevers, nausea, even diarrhea from it. The bad part about this disease is that it's requiring hospitalization, and CAT scan images of the lung show that there are damages that are occurring. And most of the time, this is not due to infection, so it makes it very hard to treat because we don't really have a lot of armamentarium to treat it, and it's new. So we're trying to work out a way to fix these people who have been hurt from vaping.
Wow, this is serious. How addictive is vaping?
Well, you got to consider that vaping has the same nicotine that cigarettes do, so it's just as addictive as cigarettes. Some of my patients have told me it's harder to quit than cigarettes because you can do it in more locations. There's not the stigma with it to do it in your car or at your house, so they don't have to go outside, so they do it more often than if they were smoking.
What are some of the long-term dangers? I mean, at this point, do we even know?
We don't know all the long-term dangers, so I would say don't be the person testing this out to see what's going to happen in 20 years. But we do know that there was a big vascular study that came out, so that's going to increase that risk of heart disease and stroke later on in life. You're also going to see these respiratory diseases that are out there. So we know that it can cause like popcorn lung as well as this severe respiratory illness. Those are going to lead to COPD in the long term, and you don't want to be one of those patients.
Wow, what do parents need to know about this?
Well, I would add this to the back to school checklist. Make sure you're talking to these preteens. You know, if you got a 5th grader going to 6th grade, make sure you're getting to them early to say, this is not safe, this can be dangerous or deadly. So make sure you're having that discussion. And even if you have a teen that's a little bit older, make sure that you're educating them that this is not a wise idea and that you should avoid it at all costs.
Never too early.
Never too early.
Dr. Light, thank you so much. Some great information, especially as we head back into the school year.